here, OMAMA SHAH, and today we will be discussing the heart failure and the drugs that are used to treat heart failure. Now, what a heart failure is, it is basically when your heart ability to pump blood and to supply blood, or in other words, I can say to deliver oxygen to the tissues, it is diminished, means the pumping ability of heart is diminished, or you may say reduced. The causes may be many, but the main cause is ischemic heart disease. It is when your oxygen supply to the heart is reduced. And why it is reduced, we know that there are three arteries, coronary arteries, that basically supply your heart. Now, when there is a formation of atherosclerotic plaque in the coronary arteries, so it reduces the blood volume coming towards the heart, and in this way it reduces the oxygen supply to the heart, and in this way the oxygen supply to the heart is reduced, and that disease is called as the ischemic heart disease. So in heart failure, the common cause is ischemic heart disease, and other causes also contribute to the heart failure, that may be include when there is a damage to the walls of the heart, or whenever there is external pressure around the heart, or vitamin B deficiency also causes heart failure. And congenital heart disease means those heart diseases which a child acquires through birth. The cardinal symptoms of heart failure are dyspnea, which means shortness of breath, means as the ability of the heart to pump is not that much good enough, so the blood supply to the lung is also diminished, so it lead to shortness of breath. Now, if the oxygen supply to the body is reduced, so it will cause fatigue, and moreover when the cardiac output is reduced, so as the ability of the heart to pump blood is not that much good enough or efficient, so your blood will be there in or retained in the blood vessels. So when the blood is retained in the veins, so we call that fluid retention, or you may say an edema is caused. This was all about the basic introduction of the heart failure. Now coming onward toward its types. So the heart failure are of two types. One is the systolic heart failure and one is the diastolic heart failure. Whenever there is a problem in the ejection of the blood, then that is called as a heart failure with systolic heart failure and heart failure with a reduced ejection fraction. Why it is called as the reduced ejection fraction? Because there is a problem in the pumping of the blood and the forceful contraction of the heart, and that is why the the blood is not pumped efficiently, and failure of heart is called as the systolic heart failure, or heart failure with reduced ejection fraction. Now, the other type is the diastolic heart failure, and the diastolic heart failure is also called as the heart failure with preserved ejection fraction, because in this the contraction or forceful contraction of the heart, or you may see the pumping ability of the heart is enough. There is a failure in the filling of the ventricle, so therefore this heart failure is called as a heart failure with preserved ejection fraction. Since in heart failure there is a diminished ability of the heart to pump, so the cardiac output is reduced. Now, in order to increase the cardiac output, the body will try to compensate, and it will activate the two mechanisms. One is the increased sympathetic activity, and the other is the activation of the RAS system. But keep it in mind that the stimulation of the sympathetic activity and the RAS system, it does not cure the heart failure, rather it worsens the heart failure. Why? Because it increases the workload on the and therefore we gave drugs that stop the function of these two mechanism, and then that drugs are then used to cure heart failure. Now first we are going to talk about the increased sympathetic activity. This is the compensatory mechanism of occupied by the body in order to increase the cardiac output. Now what I'm going to say that in heart failure there is diminished ability of the heart to pump blood, so there is decreased cardiac output. Now decreased cardiac output means that there is low BP. Now this low BP will be sensed by the baroreceptors that are present in the aortic arch and the carotid sinus. They will release the norepinephrine. So the norepinephrine will then bind to the beta 1 receptors, and the beta 1 receptors are present in two main areas, and that we already studied, that the beta 1 receptors are present in the heart and in the kidney. In the heart they will cause tachycardia, in the kidney they will release renin, and the renin will be secreted from the juxtaglomerular cells of the kidney. Now in the heart they will increase the heart rate, means tachycardia, so the BP will be increased, and thus it will increase the cardiac output. Why I'm going to say this, because we know that the cardiac output is equal to stroke volume plus heart rate. So if we increase the heart rate, ultimately the cardiac output will be increased. The second compensatory mechanism is the RAS system. The RAS system also increases the cardiac output. How it increases cardiac output? Basically, the decreased blood perfusion to the kidney due to a low in cardiac output is sensed by the kidney, and the kidney thus releases renin from the juxtaglomerular cells. So I can say that the renin is created by two mechanisms. One is by activation of the sympathetic nervous system, and the second one is by the activation of the RAS system. And the RAS system is activated. Why? Because there is decreased blood perfusion to the kidney. So the decreased blood perfusion to the kidney is sensed by the kidney, or you can say the juxtaglomerular cells, and it releases the renin. The renin, it will through circulation it arises to the liver, and in liver it converts the angiotensin to angiotensin 1. Now through circulation, when it comes to the lungs, what happens, the angiotensin is then converted to angiotensin 2 by an enzyme called as the ACE, means angiotensin converting enzyme. Now our main product over here is angiotensin 2. Angiotensin 2, it in brain it will causes the pituitary gland to release antidiuretic hormone, and thus the antidiuretic hormone it will reduce the urine secretion, and it will increase the blood volume. In the blood vessel, it directly constrict the blood vessel, and thus increases the BP, and thus increases the venous return to the heart, or you can say the atria or ventricles. In angiotensin 2 in renal cortex, it causes the release of aldosterone, and aldosterone, what it will it do, it stop the means it inhibit the sodium in excretion, and thus the water retention. It causes sodium and water retention, and thus it increases the blood volume. So when the blood volume is increased, you can say an edema is caused, because the increase in hydrostatic pressure, it will lead to fluid to leak into the interstitial space, a condition known as the edema. We studied that these two compensatory mechanism, it increases the cardiac output, but it does not cure heart failure. Rather, it increases the workload on the heart. Already the heart was in a diseased condition, and it increases the venous return, or you can say the preload. So the heart is not going to cure. Now how we are going to cure the heart failure? Now we are going to stop these two mechanism. And how we are going to stop this? If we are going to give the beta blocker, so the norepinephrine will not bind to the beta 1 receptor, and this all mechanism will stop. So the beta blocker is there to treat heart failure. The name of the drug, we are going to learn that in our next video. Now Here, if you are going to give ACE inhibitor, so the angiotensin 1 will not be converted into angiotensin 2. So the this all mechanism will be stopped or inhibited, so the heart failure will be cured. The third drug is the ARBs, angiotensin receptor blockers. If we directly block the angiotensin 2, so we are going to cure heart failure. The other one is if we give diuretics, so the more fluid will be moving on into the urine, and the edema, angioedema, will be cured in this way. The other drug is the if we give the aldosterone antagonist, so there will be no retention of sodium and water, and more sodium or more water will go throughout in the urine, and thus it will also cure the heart sign and symptoms of the heart failure, such that edema, and it will also cure the heart failure because it will decreases the preload. Now, the drugs are the beta blockers, diuretics, ACE inhibitors, ARBs, and aldosterone antagonists. So, when the cardiac output is increased or the preload is increased, it is also sensed by the heart, and the heart then in turn causes the release of natriuretic peptide. Keep it in mind, it is in order to compensate the increase in preload. The increase in preload was because of the activation of the sympathetic nervous system and the RAS system. Okay, so the heart releases three types of natriuretic peptides: A type, B type, and C type. A type is secreted by the atria, and ANP is it's called as the atrial natriuretic peptide for short. And B type is secreted by the ventricle beta natriuretic peptide, and the C type is secreted by the vascular endothelial cells. And why the C type natriuretic peptide is secreted? It is because the increase in preload, it increases the pro-inflammatory mediators, so they are released response to the pro-inflammatory mediators. Now, when the natriuretic peptides are releases, it ultimately result in the vasodilation. So when there is vasodilation, so it will decrease the BP. Inhibition of renin, the renin will be inhibited, and it will um, and aldosterone will also be inhibited. Inhibition of renin and aldosterone, and there will be a reduction in myocardial fibrosis. Fibrosis is the formation of scars, or when there are more fibers in the tissue. And why when in mostly in the diastolic heart failure, there is formation of more fibers, and the relaxation of the heart is diminished in diastolic heart failure because of the formation of the fibrosis or thickening of the wall of the ventricles, or you can see in the heart. Now, I'm going to explain this over here. This is the other drug, angiotensin receptor neprilysin inhibitor. Now, when we inhibit the neprilysin, we are also going to treat heart failure. Now, how? Neprilysin, it is an enzyme, and it basically inhibit or break down the angiotensin 1, 2, bradykinin, and natriuretic peptide. Now, inhibition of this is essential, but natriuretic peptide inhibition is not much essential for us, or more important for us, because we need a natriuretic peptide to cure our heart failure, right? So what we are going to do, we are going to give a neprilysin inhibitor along with essential for us, or more important for us, because we need a natriuretic peptide to cure our heart failure, right? So what we are going to do, we are going to give a neprilysin inhibitor along with ARBs, or you can say yes, ARBs. So what ARBs will do, it will first, the neprilysin along with ARBs, it will inhibit the neprilysin, so the natriuretic peptide will not be reduced, rather it will increase further. ARBs will inhibit the angiotensin 2, and moreover, the bradykinin. If I talk about the bradykinin, so the ACE is an enzyme that degrades the bradykinin, right? So the aces over there to degrade the bradykinin. So ARBs, we will give ARBs along with neprilysin and neprilysin inhibitor. So the neprilysin inhibitor will inhibit the neprilysin, and thus the neprilysin will not stop the function of this angiotensin 1 2 bradykinin and natriuretic peptide, right? Neprilysin and ARBs, once again I will repeat, neprilysin and ARBs we are going to give to the patient. So the ARBs will inhibit angiotensin 1 2, the ACE will break down the bradykinin. There will be natriuretic peptides for treatment of heart failure, and thus short explained. Okay, now here it is explained to maximize the effect of natriuretic peptide and ARB instead of an ACE inhibitor. Why an ACE inhibitor? Because if we give the ACE inhibitor, so the ACE inhibitor, then the bradykinin level will be increased, because the ACE enzyme is there to degrade the bradykinin. If we give the ACE inhibitor, there will be no ACE enzyme, the bradykinin level will increase. The bradykinin do vasodilation, means it is for our benefit, but the bradykinin also increases the side effects of ACE inhibitor, and that is what, that is cough and angioedema, right? So this was some basic drugs names about heart failure and the basic concept about heart failure. Hope you guys understand the heart failure and the drugs that are used to treat heart failure. We are going to remember the names of the heart failure drugs in our next video, inshallah, through tricks and tips. And Allah Hafiz for now. So thanks for watching. Alma friends. Allah Hafiz for now. Friends, Allah Hafiz.